What are biomarkers? Biological markers are measures used for the diagnosis of disease, monitoring patient health, or to test the efficacy of treatment. Strimbuquet et al. Further defines biomarkers as objective indications of medical state observed from outside the patient, which can be measured accurately and reproducibly. The key terms here being objective, accurate, and reproducible. Auxiliary features for a perfect biomarker in a clinical environment requires them to be inexpensive, produce results fast, easy to perform, and should be uninvasive as possible, or not harm patients beyond necessity. In diagnosis, screening biomarkers have greater sensitivity over specificity in order to capture more potential disease suspects at the risk of false positives. These are mitigated through further testing diagnostic biomarkers, which will produce more true positives due to higher specificity over sensitivity. However, the method will tend to be more expensive, need more expertise to do and interpret, take up more time, and will be more invasive. These markers need to be tested through a rigorous 6-stage development process. 1. A case-controlled study to match a potential biomarker to a disease. 2. Decision modeling to determine biomarker accuracy and precision. 3. Assessing key variables such as PPV, NVP, sensitivity, and specificity. 4. Diagnostic accuracy studies to see if measuring the biomarker is of any benefit to a patient outcome. 5. A randomized controlled trial to test its efficacy. And 6. Running it through a committee to see if it is good in practice in terms of financial, social, and ethical problems. The best biomarkers are from sources which directly relate to the disease pathology. For example, in Alzheimer's disease, it is easier to look for amyloid beta in the brain rather than change in the cerebral spinal fluid through a spinal tap, which could be affected by other neurological conditions unrelated to the brain. The direct cause is easier, don't you think?